Okay, we're talking about safeguarding community. Pretty important topic. We're in the middle of this, well, I don't know where we are in this thing, but we're definitely in this coronavirus pandemic, and it's affecting everybody, certainly affecting our communities. And as we talk about this, there's a caveat. This presentation is accurate as of today when I'm making it. Some of the basic information isn't going to change. It's going to be throughout the course of this, however long it lasts. Some things will change. We're redoing this a week after we initially made it because some things changed, some information was updated. So it's really important to keep up with changes that are occurring, things that we're learning that we don't know now. And this presentation is also more of an overview for faculty. There will be more detailed, very detailed instructions at each campus and each site. Some of that will be a little bit different depending on, Amity at Broadway is pretty different than Amity at Circle Tree Ranch. So there'll be some basic things that are the same, but there'll be some instructions that are somewhat different. So that's the caveat. Okay. What you're looking at here is a picture of a website, which I want you to be familiar with. It's called coronavirus.gov, which basically takes you right into the Centers for Disease Control. It's updated probably hourly. And if you want to know what's new and what's going on, this is a good site to go to. It answers a lot of basic questions, and it has more detailed stuff as well. This picture you're seeing is something from CDC, and it's titled "Stop the Spread of Germs." So, and it has all the the basic things that we're going to talk about here. Social distancing. This is something that we now know there's good scientific evidence. This is the best way for us to stop the spread of this virus because it's very, very contagious. And when people get together, either through touching surfaces or little droplets that come out of their mouth as they're speaking, or a sneeze or a cough or whatever, it's on that other person. And it's the most infectious thing we've seen in our lifetimes, for sure. And we have to treat it with a great deal of respect. So stay 6 feet apart. Avoid situations at work and outside work where you are in a crowded situation where you're likely to be close to other people and pick up this infection. Stay home if you can. Most Amity employees can't stay home. We're essential workers like healthcare workers, EMT, police, and firefighters. We got to come to work. But when you are off work, stay at home, okay? Don't go gallivanting around. Don't go to gatherings. Don't go to, if there's a restaurant that is open, most of them aren't, but don't go there. If you go to a grocery store or take precautions when you go in there. Wipe things down. Be very, very careful. And fortunately, a lot of the stores are taking their own set of precautions in terms of disinfecting things and so forth and so on. So when you're off work, stay at home. You've probably got to go for food occasionally, maybe a pharmacy to pick up a prescription, put gasoline in your car, or a medical emergency. But stay home, and if you are sick, really stay home. If somebody in your household is sick, stay home. Your salary, don't worry about it, we got you covered. Hand washing. This is the basic. This is how hospitals cut down on infections, long before this virus, just by rigorously, routinely, and always washing your hands. You can't do that too much. And if gloves are available, wear them when it's appropriate to wear them. Disinfect surfaces. Sometimes we have disinfectant. available and use it. If we don't, that's when your hand washing really comes in even more importantly. And avoid broadcasting a cough or a sneeze, a disposable tissue. If you can't do that, coughing or sneezing into your elbow, and then of course you got to change your shirt. If there is a mask available, we're going to talk about that in a few minutes, wear it. So you're looking at a picture of the global crisis. You see that the United States has the worst outbreak in the world. We're up well over 300,000 cases and 10,000 deaths. We missed the opportunity to, when this virus first hit in China, to gear up. And so many of the things that we're doing now, we should have been doing in January, but we didn't. So those policies, however, are crucial now, particularly the social distancing and staying at home if you can. So, and this is just a picture of the United States on this day in terms of where the cases are. You can see that New York has about a third of all the cases in the United States. And actually that one area has, the highest number of concentration in the world. But what is happening is this infection is in every state, in every county in the United States. And even if there is one person who has it, and there is, you're on your way to a serious infection in the community if we don't practice this social distancing and staying at home and being very careful. So we know that even though these numbers are heartrending, there's so much infection in our country and so many deaths so quickly, the numbers are wrong, and everybody knows it because we really missed the boat in terms of testing. And we're still way behind the curve in terms of testing. And the testing tells us what's actually happening. The models tell us what we think is going to happen. Definitely we expect that the numbers that we see on television and whatever, and even from the CDC, are underreported. So, how do you protect yourself and others? You're a faculty member. You're going to work every day because you care. You've signed up to help our students and you're very committed to it. How do you protect yourself and how do you protect them? Well, first thing, recognize how contagious this virus is and respect that. And also, most of the people who have the virus don't have symptoms, and they may never exhibit any symptoms. But if they have the virus, whether they're exhibiting symptoms or not, they are shedding this virus wherever they go. Somebody said, Nide said, think about it like glitter. If you've ever had glitter in your house, and if you have kids, you've of course had glitter in your house, realize you have a little bit of it and it just goes all over the damn place. It takes forever to clean it up. Weeks later or next year, you'll find, there's a little piece of that. Think about that virus spreading that way. I mean, it really goes all over the place. Fortunately, a year later, it won't be there, we hope. But everybody who is infected with this thing, whether they're showing symptoms or not, is highly contagious. So what do? Act as if you're infected and contagious. So if you're acting as if you're infected, then you protect others by social distancing, disinfecting yourself, your clothing, frequent hand washing, and avoiding other people and all crowds. Act as if every other person you meet is also infected and take the same precautions. So you've got to protect yourself from infection, okay, if other people are infected, and you've got to protect other people if you're infected. Because if you feel wonderful and act as if you're not infected and you happen to be, you could be responsible for many other people getting sick and some people dying. Okay? So please keep that in mind. That's really the best way to get real serious about this and make sure that you don't accidentally get sick yourself or you infect one of our campuses, which would really be terrible. So until rapid testing is easily available, which it's not at this point, and a vaccine, which is who knows how far off, or effective medical treatment, and we don't have that now. We have, speculation, but we really don't have anything that anybody can say is safe that's really going to make a difference if you get sick. So until those things happen, we have to practice every available prophylactic measure that we can think of. And that's how we're going to reduce the spread of this and also protect ourselves and our students. Here's some must-dos if you're a faculty member. Okay, you're an essential worker, so you got to come to work unless you're sick. We've curtailed campus trips and curtailed all but necessary visits to the campuses. So then, what's the main threat? We are. We are the main threat because if we're not careful when we're not working, we are likely to be the source of the infection getting into one of our campuses. So that really puts a burden on us, not only when we're at work, but when we're not at work, to be as safe as we conceivably can. Come to work, shower before you come to work, wear freshly laundered clothes, and disinfect everything that you touch before you enter the campus. Okay? Disinfect your steering wheel, disinfect your car seats, whatever you've sat in and touched that morning as you're on your way to work. Presumably it's a morning shift. Make sure it is disinfected before you get out of the car, and then hand wash. At work, avoid touching surfaces that may have been contaminated. Disinfect surfaces. Hand wash frequently. Practice social distancing yourself and help the students with these practices. And many of the students are really aware. They want to know that you're being careful, because they're not dumb. They understand the danger here. So making sure that circles, seminars, dining, and recreational activities, which we have to have, are done safely and with social distancing. So we want to talk about the difference. Social distancing is a little bit of a misnomer for us. What we want is physical distancing, but we don't want social isolation. We don't want social distancing. We want physical distancing and a lot of social interaction in a safe way. Our students need community. That's why they came to us. They need interaction with others. They need circles. They need meetings. They need seminars. They need recreation. Isolation is really bad for them. Okay? It brings out all of the worst characteristics. So we're talking about physical distancing, 6 feet apart and small groups, but lots of social interaction done in a safe way. When masks are available, even homemade masks, they should be used to prevent infection. Remember, this virus is really, really contagious. This is a couple of pictures of signs, and signs at our entrances and around our sites and campuses are useful to remind us and to reinforce our policies for everybody. PPES, an acronym we were unfamiliar with until recently. Personal protective equipment. Okay, PPEs are essential for doctors, nurses, EMTs, other healthcare workers who are directly exposed to infected people. They're absolutely, I mean, life-saving. And we know even with these kinds of protective equipment that healthcare workers are getting sick, you know. And if they don't have this stuff, there's going to be a pretty high mortality rate, and we're going to lose our frontline workers to help people who are sick. It's really terrible that we don't have all this equipment, and it's taking so long to get to people. So there's a shortage of these things right now. So the very first priority is to get these to the people who are at the greatest risk. And that's our frontline people in hospitals. Right now there's 1,000 police officers in New York who are homesick and quarantined. So these people who are having contact with infected people directly are at really great risk, and we need to make sure they have the equipment that they need. But we are a healthcare agency as well. And without taking from the needs of our real frontline workers, we're acquiring equipment as we speak. We're going after test kits so we can test people, disinfectant wipes, disposable gloves, disposable tissues, protective masks. We're trying to get a supply of these in to use at Amity to help protect the faculty and the students. And as these materials become available to us, our medical director will help us both distribute them, where do they go, and how much of them do we have, what's the supply like, and how do we, who gets them first and in what situations. Obviously, if we have somebody who's infected or who's quarantined, whoever is caring for them is going to, we want to make sure they're safe. So remember that the basics are the social distancing, the hand washing, you know, whether we have this other gear around, the things that are really, really crucial are these basic practices we've been talking about. Sometimes we'll have some of this equipment, sometimes we won't. Really depends. You have countries who are fighting over getting these supplies. You have every state and every hospital in the country trying to get these supplies. So it isn't like we have a special stash of them or a flow of them to us, but we'll get what we can and use what we can. This is just a slide that shows people wearing masks, wearing gloves, a little demonstration on hand washing, which is much more rigorous than you are used to. This isn't like a quick flip with your hands. This is really get that soap in there. You want to really rub it. You want to get between your fingers, okay? You want to get up on your wrists, you know. It isn't like a casual. This is something just like they do in hospitals, just like every doctor does in hospitals. And we've all seen those medical shows where they're doing that and then they come in like this, the operating room, so they don't touch anything, okay? So, mask. You may think it's silly or unnecessary to wear a mask, or maybe it's an image breaker to wear a mask, okay? I know when Nye and I have been to Japan, we worked in a prison in Japan several times, but I think we were there, 2011, and there was a bit of a flu epidemic going around. All of the counselors, all the counseling staff were wearing masks, and everything was, no one even thought about it. It was just like, well, that's what we do to protect our students from getting the flu in this confined situation in a prison. And there are many countries where it's just normal. If somebody's got a cold or something like that, they get to put a mask on and wear it until it's over so they don't infect other people. Well, there has been a recent study done, like about 3 days ago, that wearing a mask is a really, really good idea whenever you're around other people. Because these little tiny droplets, we know that a cough can go like 10 feet and a sneeze. But we don't really think about just when we're talking. You know, we aspirate little droplets out of our mouths, and if you are infected, those little droplets are enough to infect another person. So we wear the mask is not to protect you, because this is not, the masks we're going to be wearing are not medical quality N95 masks. These are sufficient to prevent our droplets from going any place other than in the mask. Okay? Then of course there's a cleaning procedure. We don't have billions of these masks, so there is a way of washing these masks and reusing them, probably for about a month, which is amazing, and keeping them, and they'll still have the same prophylactic qualities. So we just got, I think, about 10,000 masks. They're going to be distributed, and you know, so you're going to be sitting in circles, and everybody's going to be wearing a mask. And even if masks are not available, you can take a bandana, or you can make, there's a lot of instructions on the internet, New York Times, various other places, giving you instructions on how to make a mask. But it turns out, if you take 2 layers of cloth and a paper towels turns out have very, very small pores in them, and they can actually prevent the virus from getting out. So who knew? So even if the commercially made masks are not available, we can make masks very, very simply that work, and we should. That means, as faculty, when you're going to the store, going to the grocery store, mask up, you know, again, to prevent you from spreading the virus into the community.
We have an important message for all of you, especially if you live in a country that is right now facing the new coronavirus. The pandemic is growing exponentially in many countries. But the Czech Republic is one of the few in Europe that has significantly slowed down the spread of the virus. In this video, we would like to tell you what we did differently, and mainly, we would like to help you to do the same. We are following social distancing and the rule stay at home. But others do that too. We also have strict hygienic procedures. Others do that as well. But the main difference is everyone who has to leave their house has to wear a face mask. Everyone.
I know, they may be told you that masks wouldn't protect you, but there are studies proving that even a homemade mask can be partially protective. Partially. Any protection is essential today. But now the more important thing. Masks fundamentally prevent the transmission from you to others by sneezing, coughing, but also breathing. And many people are the most contagious before they start showing symptoms. So, when we both have a face mask, I protect you, you protect me, and we are both safe.
Based on recent data, we know that population-wide use of masks is essential for suppression of the outbreak.
According to our professional experience, a simple homemade mask can prevent up to 100% of the spread of potentially infected microdroplets.
The more people use masks, the less virus can be distributed and fewer individuals are exposed.
Just a few days ago, people were laughing at those who wore masks. But some people knew about this positive effect and started to share this information across social media. The message grew fast through artists, influencers, and others. I know, face masks aren't in stores, right? But something incredible happened. People started making homemade masks and giving them to others for free. Many companies, theaters, or even retirement houses changed their buildings into sewing rooms, and thousands of people started to sew masks at home. So we know that face masks work, And it has been repeatedly confirmed by scientists. We know that it is possible in just 3 days to provide face masks for 10 million people in one country. And we know that here we have fundamentally repressed the infection. Please share this knowledge and help us to change as many countries as possible. Take a picture with your face mask on and share it with the hashtag #MasksForAll. It can really save lives. And remember, I protect you, you protect me.
Okay, so there'll be instructions on this at your campus that'll be more detailed than this. I just really want to get the point across. We got to go from, oh, that looks ridiculous, to that's a safe thing to do. And we are in a crisis. So, and I've said this, but I'm going to say it one more time. We are responsible for protecting our students. So what you do on campus and what you do off campus really matters, because you are the likely source of infection in one of our campuses if you are not careful. And if you've done something that's really risky, you will be put on leave for a while. We won't let you back on campus because of that risk. So be careful, and be thoughtful. You took this job because you really care about people. And right now, caring about people means being very, very safe. So, Amity safeguarding steps, just a few of them, and again, more detail at your local campus. Everybody coming for an interview, students coming for an interview, they've got to wash their hands, they've got to take a shower as soon as they arrive, and they've got to be given fresh clothing. We don't know if they're coming from a prison, or they're coming from the streets, or they're coming from wherever. We don't know, and they don't know whether they're infected and carrying this, and we can't take any risks. So thermometers, again, these are hard to get these days because, you know, everybody wants to have one. All the hospitals need them. We're getting some, and we should, everybody who steps onto an Amity campus should get a thermometer read to make sure they don't have a fever. Group circles should really begin with hand washing. In all the meetings that we have, first we want to keep them much smaller. We want to practice social distancing so people are not touching each other or close enough to each other to put each other at risk. And people who have any symptoms or sick in any way really shouldn't be coming to any of these student activities and should be quarantined. Public transportation, avoid. Okay. If there is some emergency, you have to be extraordinarily careful because, again, lots of people in a closed space is dangerous. We've gotten these HEPA filters, use them at night to clean the air in a lot of our public rooms. They won't eliminate the virus, but they'll pick up a lot of things that are in the air that can cause respiratory problems. And if you have respiratory problems, you're more at risk. Power washers, using them on surfaces where there's a lot of traffic. And all visitors, vendors, parole officers, whoever's coming and has been approved as a necessary visit, and most of them are not necessary. They can wait until this has calmed down. But if they do come, they've got to come and wash their hands before they step on the campus. And they should take care of their business not in a public room, never in our living quarters, and never in rooms where a lot of people are meeting and activating. Find a space that is going to be designated for visits, and then after a visit you can disinfect that room. If they are allowed on other parts of the campus, that becomes much more difficult. Again, you will get more detailed instructions on this. This is just a few recommendations from a guy who was a molecular virologist who worked on coronaviruses beginning in the 1970s. So he's had a little experience with it. And these are just real simple. Some of them are repetitious, but no handshaking. If you have to do an elbow bump, okay, but even there, I think those are kind of gratuitous at this point because you're closer than 6 feet, unless you have really, really long arms. Be careful with things like switches, elevator buttons. When you go and get gasoline, the handle of the dispenser, you grab the handle. How many other people grab that handle? Okay, you don't know. Okay, so you got to disinfect it. Door handles are difficult. If you don't have gloves and you've got something where people are touching it all day long, some way of opening that door without doing it, or immediately go and wash your hands, okay? Because you don't know. If anybody was infected and walked through that door, guess what? You just joined them. Use disinfectant wipes. It's when you go out in stores, if you've got them. If not, again, anytime you touch something you think it's been contaminated, you cannot disinfect it because you don't have disinfectant wipes, then you're immediately going to go and hand wash, thoroughly. Washing your hands, we've talked about that. If you have sanitizer, and there are sanitizers that some of them are actually repeated use is not so good for your health, but right now, probably the worst thing for your health is getting the virus. But use hand sanitizers when you can't wash your hands. And we talked a little bit about the coughing and sneezing. But again, we're about ready to enter mask mode. So get comfortable with that idea and learn how to take care of them also. One of the problems with the masks is that people are a little uncomfortable with them, so they're reaching up to adjust them with their hands that haven't recently been washed. They've just touched the surface and whoopee, you've just infected yourself. So once you put the mask on, don't mess with it unless, even if it's irritating you, go and wash your hands before you touch that mask. And they've had medical professionals who have infected themselves taking off the protective clothing because they didn't do it carefully enough, or they didn't hand wash immediately afterwards. So be careful. Be careful. Again, each campus will have a specific set of instructions. You're looking at a picture now of the National Council for Behavioral Health. That's the field we're in. COVID-19 guidance for behavioral health residential facilities. This is something that our medical director and our executive staff are using, plus our own experience, to work and develop protocols for each campus, in addition to what I've just shared with you. We're going to try and every week update policies that need to change because we've learned something new, or update you because we have some supplies that we haven't had before. And we're going to do every possible thing we can to keep you safe as a faculty member, and to keep our students safe, and to keep our communities safe. We have a responsibility there too, to act appropriately so we do not inadvertently either pick up the virus or spread the virus and are off when we're not working. So let's all be safe.